This is Dr. Robert Antolak from the Gentle Dentist, and right now I just wanted to go over a little difference between an upper complete denture or a lower complete denture and a fixed hybrid denture. I know I've talked about this before, but when you have a denture like this, it depends on the ability for your teeth to come together, for you to chew, of course, but you can only put about maybe 20% of the chewing capacity that you have with a denture compared to your natural teeth. Well, the question is why? And so the reason is that when we bite down with a denture, all that pressure is transferred to our gums, okay? And when that takes place is these dentures can rock back and forth, and you don't have the ability to chew things too hard, because when you push up, it compresses that soft tissue and then can even dislodge the denture from up to back. So that's really important, even to have an opposing arch of teeth, so that even with a denture, that it can hit up evenly to keep these pushed up as best as possible. If you do have a full denture, keeping it up and using some powder adhesive like Fixodent, it works really well. What that does, if you need it, it helps to keep it up, but then you got the goop and everything else that you have to work with when you're taking it off. But it does move around, it just doesn't fall down with using these denture adhesives. Of course, the best thing we can do for ourselves, if that's the case, is to transition into what's called a fixed hybrid denture, where we have natural teeth not natural teeth, but we replace our natural teeth with implants. And if you can see right in here, there's actually implants that go into the jawbone, and then the denture itself is made so that actually screws down into the implants, giving it the strength that it would have close to what our natural teeth would be when we bite down firmly on it. The benefit of these is that it does not have the roof of the mouth that's covered, okay? So that way you can feel the food, you can taste the food, you can bite down firmly, because implants get fastened right to bone. It's just a tool, like a screw that goes into the bone, and then the fixed hybrid denture gets placed over the top of it and gets screwed down. So you basically transition all of your force directly to your bone, and doesn't not even apply and hit the gums itself like that, okay? And here's another case that we did before. It does have a metal support underneath it. This is using called like a plastic teeth. And the reason why we recommend that is sometimes the zirconia that you'll be seeing about is it's so hard that it sounds like it's like two rocks hitting together when you're chewing. And it is also can be very abrasive to your natural teeth if you have natural teeth on the lower. So we use a system that uses the metal, which you never see the metal, and it's got the plastic teeth on the side. And so these are made so that if something happens to your teeth, that we can actually get the laboratory to make a duplicate of it and then have it just placed right back right onto this metal frame. So anyway, so this is called a fixed hybrid denture. We do these here many times for patients. They come in wanting something, and then we're going to recommend this versus a denture, because it once again, it's a much better long-term permanent solution that allows people the next best thing next to your natural teeth. So if there's any questions, you can feel free to call us at 586-247-3500 or our website, thegentledentist.com. And thank you, and have a blessed day.